collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
Coming up on the programme this week, we'll talk at length to our Minister of Health about the implementation of the National Health Scheme.
Once the NHS is in place, every patient that is covered by the system will be able to choose the doctor or the nurse of their liking, and the National Health Insurance Organization will have to pay according to the choices of the patient.
The Interior Minister on a plan to encourage audiovisual investment on the island.
I think we have designed a very competitive scheme, providing a number of incentives.
And we'll discuss with the opposition party, Akel, the changes to the university entrance requirements for the University of Cyprus.
We are waiting for the government to bring up a proposal, a complete proposal, which could give a solution to this issue.
It's a couple of months now since the relevant laws were passed, setting us finally on the right path for universal healthcare on the island through the National Health Service, or GESY, as it's known here on the island. Joining us this week is the Health Minister, George Pamboridis, to talk about what comes next. So what does come next?
Well, the main step was taken, as you just mentioned, on the 16th of last June. It was the most essential part, because without the legal framework we cannot proceed to implement the universal health system in Cyprus. So now we are in the phase of following the practical implementation steps that we were advised to take by our global advisors when the whole system was designed. As you probably know, the first phase includes the autonomization of the hospitals, which is a very crucial step, as it envisages the reform of the public hospitals in a way which will allow them to compete openly with the private hospitals once the NHS is in place. Maybe it will be helpful for your listeners to know at this stage that the NHS in Cyprus is different from that of the UK, in the sense that it does not work solely with the public system. It engulfs and embraces the private sector as well, and each patient, each legal resident of this island will have a free choice of his or her service provider, and that's what makes all the difference in Cyprus. So once the NHS is in place, every patient that is covered by the system will be able to choose the doctor or the nurse of their liking, and the National Health Insurance Organization will have to pay according to the choices of the patient.
And presumably that means that the costs are going to be pretty equal across both the private and public caregivers.
There is no other way. The costs will be agreed for all participants, irrespective of whether they are in the private sector or in the public sector. And this is exactly what guarantees the viability, the financial viability of the whole system. So the good thing is that there will be an open competition between the public and the private sector for the custom of the patients. So these two sectors will need to fight it out to convince patients to opt for them. Of course, that it's much easier than it sounds, in the sense that in a properly functioning system, there should be no direct competition between the public and the private sector. Each sector will take the piece of the pie that it should, in the sense that when you have chronic patients and cash-intensive investments with low margins of profit, we don't expect the private sector to show any interest. So that will be left for the public sector to carry on. Whereas when you expect speed and cutting-edge technological advancements or flexibility that usually the public sector cannot demonstrate, you will be looking for that in the private sector. So
but then how can the government hospitals, if they're taking, if you like, the least profitable patients, maintain themselves?
It all boils down to how well the least profitable services are compensated by the National Health Insurance Organization, because the actual compensation is not only related solely with the actual cost, but it relates also to the investment that goes with that. So if the government hospital spends millions to provide blood dilution for our thalassemics, and there are only 650 of them, and pays millions to provide adequate hematologists who will cater for this community, all that will be taken into consideration when deciding what the actual compensation for the provision of each service would be. So eventually the system will be paying for that. It's just that the profit margin is not there. No business plan can make a target group of 650 a viable project. But for the government, this is not an option. We need to cater for the needs of everyone. And the chronic patients are one of the most significant part of the public service focus.
I seem to recall that the whole system is also going to rely to some degree on family doctors, what we call general practitioners,
yes.
So that we get out of this habit of, oh, I've got a headache, I'm going to a neurologist. I go first to the family doctor who makes an initial diagnosis and then refers me on or says, I need to go and see a neurologist, at which point I go either to the public or to the private sector. How is that whole system of family doctors going to be implemented? Because it's something we don't, to a large degree, have yet.
Yeah, it's a cultural thing. We do have GPs, adequate number of GPs, and we will try to teach the people to change their manners and their way of thinking. Traditionally, Cypriots, as you very well pointed out, they tend to opt for a specialist straight through instead of going through a GP. However, this is not a cost-effective system, and any national health system needs a gatekeeper. The GPs are the gatekeepers, and not only that, they also serve a significant part in our vision for long-term public health, in the sense that it brings every single one of the insured people under the radar. Whereas now, for a Cypriot to turn to a doctor, something must be wrong with you. Unless something is wrong with you, you don't go to the doctor. This is wrong. You need to be under close monitoring from the time of your birth until you die. This allows preventive and preemptive medicine to kick in, saving huge amounts to the whole system. So we need everyone to register with the GP, and all the population will be asked to register with the GP, either in the public or in the private sector. And if they're not happy with their GP, they will have an option to change their GP every 6 months.
And what about, I mean, for example, paediatricians? Will they start to operate in GP clinics?
Yes. Pediatricians are considered to be GPs for the system. The same goes for gynecologists. We believe that children up to the age of 16 and all women should have immediate direct access to these two specialities without having to go through another GP. So we have elevated them to a GP status, and women and children up to the age of 16 will be able to register with them instead of a GP.
Now, you mentioned the insurance. There was a lot of fuss about whether it was, well, how it was going to work, basically. Has that all been sorted out
Yes.
now? And when do we start paying?
Okay. There are going to be 2 phases of introduction for the NHS. The first phase will cater for all primary care and out-of-hospital patients, and that includes GPs, specialists, diagnostic procedures, chemists, microbiologists, and all these things, MRIs, CT scans. And that phase will be implemented on 1st June 2019. And on 1st June 2020, we will have the full NHS implemented, including the hospital phase, the hospitalization phase, the inpatient.
And is this on track for those dates? Because that's the other thing, of course, over the years we've seen dates come, we've seen them go.
No, it is on track, and everything will be implemented on time. But to go back to your question, when do we start paying? You start paying 3 months prior to the date of implementation. So for the primary phase, you start paying on 1st March, so that you will get the service on 1st June. And for the second phase, the final phase, you start paying on the 1st March of 2020 to get the full service in June 2020.
What happens if I need surgery and hospitalisation after the introduction of the first phase in 2019, but before that date in 2020?
You're not covered.
So I use the same system as we have now?
No, you go for the phase of diagnosis. You will enjoy the benefits of the system. But if you need to go to surgery, unless you are covered today, as the system applies, you will not be covered. It's like having a new insurance policy, and you opt for an insurance policy for 2019, which only covers out-of-hospital patients, and then you start your cover for both out and inpatient care on 2020. If something happens to you on the first year, you will only enjoy what you're covered for, not the rest.
So basically, as it is now?
Yep.
You've mentioned that legal residents are covered. Who are legal residents, actually?
Everybody who is on the island, resides permanently on the island, and is not an illegal alien. That includes all European citizens and all third country citizens who are legally staying in Cyprus.
And then dare I mention Brexit? Is that going to affect the UK residents here?
No, I believe that people from the UK residing in Cyprus will continue being considered legal aliens as a part of the agreement between the European Union and Britain over Brexit. So I don't expect any surprises there. But even if there are surprises there, I do expect that Cyprus and Britain will enter a bilateral agreement by which they will regulate these issues. So I think people should assume, British people living in Cyprus should assume that they will be legal aliens even after Brexit, and that will mean that they will be able to be fully covered by the system.
They will pay their insurance like everybody else?
Exactly. 2.65% on their salary or on their pension.
You must be feeling pretty good about the fact that in a long line of health ministers since this was first mooted, you're getting there.
I have to admit I do, yes.
Cyprus Health Minister George Pamboridis talking there about the upcoming implementation of our National Health Service.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
I went recently to the Presidential Palace in Nicosia for a press conference on the promotion plan for the audiovisual industry in Cyprus. It was attended by the Finance Minister and the Interior Minister, and I caught up with the latter, Konstantinos Petridis, immediately after the conference. I asked him to explain the idea behind the plan.
This is an investment scheme for attracting investments in audiovisual productions in Cyprus, mostly from foreign producers. There are similar schemes in other European countries like Malta, Ireland, the UK, Germany, France, I think we have designed a very competitive scheme, providing a number of incentives for these producers to be active in Cyprus, like cash exemptions, tax rebates, and other financial and non-financial instruments like facilitating visas and licensing.
Malta has been hugely successful.
Yes, it has been hugely successful, and actually it is one of the examples that we have very carefully studied, and I think we're quite competitive also to Malta.
One of the problems we've always had in Cyprus is the bureaucracy, the length of time it takes to get permissions or to get licenses and so on and so forth.
That's also provided by the scheme, not the bureaucracy, but to facilitate all the licenses through SIPA. It will be very easy procedure for those who are interested.
And we should say that's the Cyprus Investment Promotion Agency.
Yes,
SIPA.
the Cyprus Investment Promotion Agency.
Right, but if we go back to this business of bureaucracy, just to broaden it slightly, it is something you've been working on, I think, for a long time, to try and cut through the red tape. Is this in a way going to help us cut through it in other departments too?
No, it's for the specific sector. In every sector of economic activity or every sector of governmental activity has its own procedures, its own bureaucracy. It's very different from each other. I want to believe that this sector is relieved from an overburden of bureaucratic or red tape.
But now that you're Interior Minister, are you able to follow up what you started when you were the Presidential Commissioner?
I told you it's a huge task, and all the ministries should deal with cutting the red tape and bureaucracy from their own ministries. I mean, in just a few weeks, I'm going to submit a law providing for facilitating cutting red tape and bureaucracy for big investments, and I think it's a duty of every minister to try and reduce bureaucracy and proceed to process engineering for its own activities, for its ministry's own competences.
Cyprus Interior Minister Konstantinos Petridis talking to me after that press conference held by SIPA on a promotion plan for the audiovisual industry in Cyprus. The Maritime Cyprus 2017 conference opened in Limassol earlier this week. It's organised by the Ministry of Transport, Communications and Works, the Department of Merchant Shipping, the Cyprus Shipping Chamber and the Cyprus Union of Ship Owners. This year's event was entitled Yesterday's World, Tomorrow's Today, and it was attended by more than 850 shipping personalities from around the world. President Anastasiadis made the opening address, at which he said that Cyprus had established itself as a respected maritime flag and a base for international shipping operations. The shipping sector, he said, had been catalytic to the recovery of the Cyprus economy, and he referred to the need to focus on the future of the Cyprus shipping sector to safeguard its steady and substantial growth. The President announced his government's commitment to establishing an independent deputy ministry for shipping, which he said will start functioning on the 1st of March next year. Discussions at the conference included one on the future shipping strategy, regulators versus industry, where it was stressed that regulators need to be more proactive and the speed of adapting to technological developments should increase. Another panel discussion explored what the future holds for ship owners, at which panellists mentioned that the market is improving and that the supply and demand of bulk carriers seems satisfactory. The impact of the Chinese economy on the profitability of the shipping industry was analysed, and it was noted that the Indian economy is also experiencing impressive growth. And finally, the importance of innovation was highlighted, as indeed was the existence of quality-focused services. Since shipping accounts for something like 7% of Cyprus GDP, the Maritime Cyprus Conference is always considered to be a very important one, particularly in the shipping centre of Limassol.
You can subscribe to the Cyprus News Digest on iTunes for free and get the program downloaded to your phone or tablet so you can listen anytime, anywhere.
Christos Christofidis is from the political bureau of Akel, and he's joining us to discuss the recent change to the university entrance. Christos, can you explain first why Akel was against allowing students from private institutions who hadn't taken the Pan-Cyprian exam but had other qualifications, why they shouldn't have been allowed entry into the University of Cyprus?
Yes. First of all, this is not the case. Akel said several times that we are ready to discuss with the government and in the parliament a legal way of solving out this issue. Before the elections for the new parliament in 2016, the president of the Democratic Rally, Mr. Averos Neofidou, was moving around and meeting with the parents of the students in private institutions, promising to give a final and legal solution to the issue. A year and a half after that, we are still waiting for a proposal with the government, and we are facing a lot of legal issues because on one hand, the University of Cyprus is moving unilaterally to implement solutions they think that they are the good ones, and the Ministry of Education washing their hands and saying that if there is a legal advice, we cannot do anything about this issue. So what it should be done, clearly, we are waiting for the government to bring up a proposal, a complete proposal, which could give a solution to this issue.
Why is it that the university is not allowed to accept any students from anywhere that it thinks have the qualifications to complete their studies and possibly go on to do research and other things at the university? Why should it be the government and the parliament, who presumably passed the original law in the first place, who say who can and who can't study at the University of Cyprus?
Because we have a specific law environment in which the university should move, and we have a public university which should give to the elected members of the parliament, who is giving the money, and the government is giving the money to the university, a feedback that they are actually following the law. And as you know, we have an issue with Mr. Odysseas Michailidis very recently, who is very active on this issue, and he is in a way suggesting that the procedures followed by the University of Cyprus weren't not only the legal ones, they had a problem of following a proper and based on concrete criteria way of accepting students. This is what we want to safeguard. We want to safeguard a justice treatment for all students. We want to safeguard a just entrance for everyone, and want to safeguard that if we do have extra seats in the University of Cyprus, these extra seats could be in a way, how to say it, each student must have the right to compete and to succeed having one of those extra seats in the University of Cyprus.
You say safeguard the fairness and the justice. If there is, and there have been, Greek Cypriot students who have taken A-levels or the baccalaureate, they don't have the same chance to get into the University of Cyprus unless they take an exam for which, unless they take private lessons, they have not been prepared. So that is not justice, and it's not safeguarding the right of everyone. My question really is, why, since the University of Cyprus in its relatively short time of establishment has reached into the top several hundred in the world, it's obviously not going to take students that are not going to, in a sense, give the university the kudos that they want. So it's looking for the cream of the crop. And that includes some students who've been to private education institutions. Why can't they just choose who they want? Why can't Parliament say, as long as they have X A-levels or a baccalaureate or the Pan-Cyprian exam, they can apply? Because right now, those private students who haven't done the Pan-Cyprian exam have to apply to a foreign university, get accepted there, and then transfer back here, which, let's face it, is jumping through unnecessary hoops. It's not fair. And we're discriminating against Greek Cypriot citizens.
My answer will be very short. Isn't it funny? After 5 years of this government, Anastasiadis government, we are still discussing and waiting for a concrete proposal for this issue.
Why doesn't Akel make a proposal?
Isn't it funny, the fact that one of the main obstacles in solving this issue was Mr. Tagliadoros, a member of the Democratic Rally when he was in the leadership of the secondary level teachers' education. What we are suggesting is to find a legal and fair way to solve this issue.
But can't Akel put a proposal to Parliament? Can't you make an amendment?
Akel made several proposals, including a percentage with the GESY exams, which some people might be it wasn't a satisfying proposal, etc. But there was a proposal. But we are waiting for the government, for the ministry, who has the knowledge, who has the know-how, who has all these people working, all these bureaucrats, hundreds of bureaucrats in the Ministry of Education, to bring up a proposal for 5 years, and they just move things around before any elections, as they did in 2016 with Mr. Averov Neofidou, and 5 years after that we are stuck on legal issues, on the problems of the unilateral moves by the University of Cyprus, etc. So what we are actually expecting, it's a concrete proposal, and on this concrete proposal we will make our proposals as well. Thank you very much.
So would you vote in favour of a proposal that made it equal for everybody?
When we will see the proposal, we could say our opinion. If we do not have a proposal, we cannot say our opinion.
Christos Christofidis of the Political Bureau of Akel, bringing our discussion pretty firmly to a close. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.